Hey, I'm Dr. Dino Pappas. Thanks for joining me. The views in this video are my views and my views alone. They do not represent the views of any entity or agency that I may be affiliated with. I get so many questions in the office, especially this one, is running bad for my knees? Well, I live in Austin. There are a lot of runners in Austin, Texas, so you can imagine I get this question quite frequently. There is a pro, a yes, and a con, a no as to answer this question. Unfortunately, this is not a black or white answer. It's actually shades of gray, and it's highly dependent based on the patient and what they are bringing to the table here. Unfortunately, if patients will talk to some physical therapists, some sports chiropractors, or some orthopedic surgeons, sometimes patients will get a flat yes or a flat no. The reality is the answer that works best is more like shades of gray. So, is running bad for my knees? The answer to the question for some is yes. And the answer yes is for those patients that have mechanical symptoms. What are mechanical symptoms? If you have situations where you need locks, catches, pops, clicks, you start to have instability, feelings that you're going to fall over, balance issues, or major weakness in your knee, then running is probably not a good idea. The good news is that's a very small percentage of those population that have these mechanical symptoms. Again, locking, catching, popping, clicking, weakness, and instability in their knee. Running would be a bad idea if you want to increase your volume, the amount and the distance that you run over a short time period. If you go from nothing to a marathon in 2, 3, 4 weeks or a month or two, it's probably a bad idea. Your knees are going to start to push back. Running is a bad idea if you're running chronic high volumes. Now, volume is dependent on the person, but if you are the marathon runner that is running 60 to 80, 80 to 100 miles consistently for weeks and weeks and weeks and weeks on end, unfortunately, your knees can push back and start to become painful and problematic. We're just not designed to run that much, that often, that frequently at that volume. Running is probably a bad idea if you have a major structural deformity. If your shin is bowed, if your shin is twisted, if there's a structural issue in your hip or in your foot or ankle, running is probably not a good idea. So those 4 situations that's running bad for my knees would be a yes. On the flip side, running is a good idea and not bad for your knees because over time, the body learns to adapt. The cartilage, the soft tissues, the bone can adapt. We once thought that, hey, when you ran, you would see a decrease in cartilage. Cartilage is this tissue, this soft tissue that exists between the bone, here's the thigh bone, and here's the shin bone. In between, there's this cushion surface called cartilage. Over time, we once thought that as you ran, that cushion surface would decrease, but what we've actually found over time is quite the opposite. And many runners, they actually have more thick, more plump, more cushion, more cartilage in the runners than in the sedentary group and in the other group that was just told to do nothing, do normal activities. So running can actually lead to progressive adaptation in those tissues, and that's a good sign. Running has general health benefits like weight loss, cardiovascular, blood pressure, makes your blood pressure better, regulates hormones and feelings of self-worth and stress and anxiety. So running has general health benefits, which help the physical health benefits. So if you're getting general health benefits from running, let's have you continue. Running also increases confidence, reduces stress, anxiety, depression. It gives you a sense of community, companionship, friendships, and relationships. Those are all positive things. And if you're getting that from running, then let's not take that away from you. Let's encourage that as long as it's safe for you to have those positive psychological and psychosocial aspects. Last thing, there's been a trend over the years for more imaging, more x-rays, more MRIs, more CAT scans on anybody. These technologies are commonly accessible and relatively inexpensive with regards to other things. A lot of times you'll go to a doctor and they'll put an x-ray of your knee up and they'll say, man, you got some decreased cartilage loss, or man, your knee joint isn't looking very good. And patients are often scared. Well, I want to say that you are not your image. And what does that mean? Even with these anomalies and abnormalities, patients can be quite robust, quite functional, quite able to tolerate running. So you are able to run and you are confident in running, and even if that image doesn't look quite right, please continue running because it has general health benefits, communal and psychological health benefits, and yes, the tissues may be able to adapt over time as long as it's safe and a good idea for you. So I'm Dr. Dino Pappas. Thanks for joining me. Please hit subscribe. Please turn on the notifications.